Hi, my name is Stefan Georgi, and I'm here today with Dr. Ken Eagle of Eagle's Touch Chiropractic in Melville, New York. He also is a member of the Braincore Therapy of New York group, a group of doctors offering neurofeedback therapy. Today, we're going to talk with Dr. Eagle about what neurofeedback therapy is, and specifically how it relates to your brain and brainwaves and brainwave dysregulation, some other terms like that. So, Dr. Eagle, I'm going to go ahead and just turn it over to you. And I guess the first question is really, what are your brainwaves? How do they affect like your conditions and processes and sort of your mental and physical well-being?
Sure. Thanks, Stefan. Everybody sees the name brain therapy, brain therapy. How do you do therapy for a brain? And it's actually very fascinating. The way the brain works is basically a complicated symphony of organic electrical activity, which helps the brain communicate with itself. The brain controls and coordinates all the bodily functions, so it's really important that this communication system be clear and uninterrupted. Um, so this complicated system of electrical activity, it doesn't just happen from cell to cell. It actually happens in big chunks, and they fire at the same time, and it creates this wavy sort of cascading effect. And it goes back and forth and enter different parts of the brain, and is very, very intricate procedure. But to make it as simple as I can, these waves not only control and coordinate, firings for the body to function, it also coincides with states of mind. So if a brain is globally working properly, it's going to be able to shift from different states of mind when needed. So it's going to be able to, be slow and tired and sleepy when it's time to go to sleep, and very fast when it's important to process information quickly. When there is a dysregulated global pattern, people can get stuck in a very fast pattern or a very slow pattern or in an idle pattern that doesn't have the ability to shift when it needs to. So slow brain waves, again, really important when they're supposed to be there, when you're trying to sleep, you're trying to calm down, you're trying to relax. But if the brain is stuck in that pattern, it's hard to be alert and be awake when it needs to be. We were talking a little bit about, you mentioned a little bit about anxiety and depression. Anxiety is typically a fast wave pattern. So globally, a person's brain is just running a little too fast. There's just too much of what we call the beta brainwave. It's running too fast, and they just can't quite calm their brain down, so they become very anxious. They're prone to panic attacks, to insomnia, to um, uh, chronic pain conditions. Those are the type of things that happen with a global fast wave issue. What we do is we do a very detailed analysis. So we actually use electroencephalograph, which has been around and recording human brain waves since um, about, I think it's 1924, so they've been around a long time. And obviously, technology has gotten much much better. But what we do is we put this cap on the people's heads. It's a completely non-invasive procedure where we actually record brainwave patterns, and we take that recording and we filter it through a database. This database has thousands and thousands of what we call normal brain patterns, and what we mean by normal is that they're just not affected by any symptoms. So we do this statistical analysis of our patients' brainwaves, compare it to this huge normative database, and that report comes out very detailed and gives us probability readings, probabilities of global dysregulation, whether a slow brainwave pattern, an idle pattern, or a fast wave pattern. And it also gives us even more detail into focal site dysregulation patterns. So that would be very specific areas of the brain that affect very specific types of behaviors and symptoms. And it gives us probabilities as to, if those areas are working, properly or not.
Huh. So that's really interesting. So I mean, you're actually you're measuring activity. You're referencing it against the database, and you're getting sort of a reading, comparing to a baseline and looking at probability. So if I am shown that my brain is kind of moving too fast, or those brain waves are firing too quickly or too slowly, or really are just dysregular, What's the next step for me once you guys have determined that?
Okay, so once we get this detailed report from our database analysis, it actually gives us a statistical solution. It tells us, all right, for this type of brainwave pattern, whether, again, if it's an overarousal or an underarousal situation, it tells us statistically these are the best areas of the brain to train, and this is the best way to do it to get the most out of our training sessions. At which time we then have the patient come into the office. We hook them up to another electroencephalograph, typically a one or two channel instead of the global one that we do for the mapping. And we have them do an activity on the computer where they're sitting in a nice, comfortable, relaxed position, watching something that's happening on the screen, and we're actually controlling um, the doctor's portion. So we pick the protocol that's best served to help re-regulate their brain patterns. And over time and repetition, their brain is actually exercising itself to, we'll call it, create new circuitry um, to help compensate for the areas that haven't been regulating properly.
Huh. Um, can that be comparable to the idea of neuroplasticity at all, and that you're forging new kind of neural pathways, or is it different than that?
No, that's exactly what it is. And it's funny because not that many years ago, proper scientific thought was that we kind of were stuck with the brain that we had, and
Okay.
there wasn't any changing it. And then they really discovered this concept of neuroplasticity, and that is the ability for the brain to learn new things at pretty much always has that ability. So if given direct training and very quick, proper training, the brain has an amazing ability to create new pathways, create new circuitry, so to speak, to help it function optimally.
And yeah, so I mean, I know everyone's different, every case would be different, but how long generally does it take to sort of create these new neural pathways? Again, recognizing that the severity and things, different factors may affect whatever
Certainly.
you're going to say. But yeah, but just in general, I guess.
Yeah, well, certainly there is. Yeah, obviously it's individual and it would depend on a specific case. But there is pretty much three different phases of neurofeedback training. The first one is called acquisition. Acquisition happens in the beginning where you're just teaching the brain to fire the way it should be firing, so to get these brain waves working the way they're supposed to. And with that, that sort of creates um, it sort of draws the building materials, we'll call it. We'll just try to make it as simple as possible. It brings the building materials together and it starts to fire together and rewire together. Um, that's the first phase. Second phase is called consolidation, and that comes afterwards. So often during the acquisition phase, we start to see some improvements and changes in people's symptoms in that process. But once we move into consolidation, that's where we make it more of a permanent change. So now it's taking those materials and it's actually creating this new circuitry in the brain that it's going to then use, for many, many years to come. Third phase is called generalization. There's a lot of different ways we can actually call that phase, but that's where we actually start to bring people a little bit less reliant on their training and more reliant on using their new circuitry in their, regular environment. So we start to bring the training sessions down a little bit, still support them with training sessions, but not as often, and let that brain really lock into the changes that it has made.
Awesome. And you guys, you're both in Melville specifically, and then Braincore of New York in general, the whole group. Do you work with a lot of patients for all kinds of conditions, I believe, and that includes anxiety and depression? Is that right?
Yes, yes. We have started us off with anxiety before I went on a tangent. Anxiety is one of the conditions that I work very closely. There's a lot of conditions that are associated with overarousal. Anxiety, it fits right into that one. So I get a lot of people who come in with, anxiousness, panic attacks. They're overly aroused. They can't slow their brains down. They're just, it's just too much activity. They don't know why. They can't control it. Sometimes they come in, having taken medication. Often they come in trying to get off or avoid medication, and they want to make a correction that's going to last in their life, so that they're not reliant on medication to um, pretty much control how their body is functioning.
Sure, cool. Awesome. So if you want to talk to Dr. Eagle yourself, make a appointment or a consultation, his practice again is called Eagles Touch Chiropractic and Wellness. That domain is www.theeaglestouch.com. So like eagles in a bird, theeaglestouch.com. You can also visit his practice in the Braincore of New York group through braincoreny.com. If you go there and look over at locations, you'll see, again, Braincore Therapy of Melville, which leads you to Dr. Eagle. So, Dr. Eagle, thank you for taking the time to speak with me today. Is there anything else that you'd like to add before we finish up here?
No, I really appreciate it, Stefan. Thank you so much.
Absolutely. Thank you. Have a great day.
You too. Bye now.